Okay. I have been dispatched to a motor vehicle crash. I've already checked all of my equipment. Everything's working. I have everything that I need. BSI scene safety. The first thing I do is determine the mechanism of injury and how many patients I have. Obviously, it's the ejection from the vehicle, and I have just the one patient. I'm going to request ALS backup right away. So there we go. I'm going to apply C-spine precautions due to the mechanism of injury, and then I'm going to form my general impression. I have a 24-year-old female who has been ejected approximately 30 feet from her vehicle. First thing I'm going to do is determine level of consciousness. So, hello, ma'am. Responds to supraorbital pressure, painful stimuli. I'm going to assess her ABCs. Her airway is patent, and she's breathing at a rate of 30 breaths per minute. I'm going to auscultate the lungs. So, okay, painful stimuli on the right side of her chest. Decreased lung sounds on the right side. And noting that and the 30 respiratory rate, I'm going to put her on a non-rebreather, high flow at 15 liters per minute. Okay, so I'm going to assess her radial pulses. Pulse is weak and at 130 beats per minute. Noting that, I'm going to assess her bleeding. I notice bleeding on her right leg, so I cut back her pants or whatever clothing she might be wearing, and I notice the bleeding is minimal. Straight painful stimuli to the right leg. Okay, so next I'm going to assess her skin, which is pale, cool, and moist. And noting that, along with the pulse rate, I'm going to start shock treatment, which I already have her on 15 liters per minute. So this is going to be a priority patient due to the respiratory rate and the mechanism of injury. So we're going to spend as little time as possible on this scene. We're going to transfer as soon as possible. Can't obtain a sample history due to the level of consciousness. So now we're going to do a secondary exam. I'm going to start with a head-to-toe palpation. Nothing. Eyes are pearl. There's no fluid coming out of either ear. So next, palpate the neck. No JVD or tracheal deviation. I palpate the chest. Painful stimulus on the right side of the chest, but the chest feels stable. I palpate the abdomen for rigidity. Abdomen is soft. Next, I palpate the upper legs. Notice painful stimuli again. And from there, I discover a leg deformity on her lower right leg. Having noticed that, I will assess for pedal pulses. Pedal pulses are present, and due to her level of consciousness, I will not be assessing CMS because why would you? Reassess radial pulses. Both are present. Palpate arms. Nothing. So now I'm going to manage secondary injuries. The leg will be splinted when we attach her to a backboard, which we have to due to the mechanism of injury anyway. She's already on 15 liters per minute, so we're good there. So I load the patient up on a backboard. While I do it, I assess the back and notice nothing there. Now would be a good time to assess for baseline vitals. Blood pressure of 92/68, pulse of 108, respiratory rate of 22. Since my secondary injuries are managed, I will continue to reassess breathing sounds, and her leg including distal pulses. I will continue reassessing vitals every 5 minutes. Arrive, I'll go to the hospital. I'll find someone of equal or higher ranking to me. I will hand her off to that person, obtain the signatures and paperwork needed, and then I'll leave. So, this assessment is over. Thank you. Thanks, babe.